What is up, you guys? Welcome to this channel. If you are new here, my name is Mimi. I am a registered nurse and I'm actually working right now as a nurse educator, and I've been a nurse for 8 years. As you can see from the title of this video today, we're going to be talking about nursing interviews because I've definitely done a few nursing interviews along with my nurse manager. I definitely have a few things to share with you guys today. Maybe some of the do's that you should do during a nursing interview, and definitely some of the deal breakers that you should never do. So first thing first that I would say is definitely make sure that you look the part. That is, make sure that you are dressing professionally when you come in. Get your hair done. Make sure your nails look okay. Definitely be ready to be interviewed, and definitely make sure that you guys do come on time. Whether it is a Zoom interview, WebEx interview, it is 2021, who knows? Just make sure that you are ready to be interviewed, okay? So the second tip that I would have for you guys is take a few moments and answer this question. Who are you, right? Most likely on any nursing interviews, they're most likely going to ask you, tell me about yourself. Who is Stacy? Who is Glenda? Who is Mimi? Who are you, right? Take a few moments to think about how you're going to bring your resume to life. Tell them about some of the exciting things that you have done. Maybe try to be a little bit strategic about it as well. When you're answering about tell me about yourself, think about some of the things that you have done that could probably be really helpful with the position that you're applying for now. So definitely be ready to answer that questions because they definitely want to get to know you as a person. Because I always tell my nurses or anybody else, we can always teach you skills, but there are some things that we just definitely want to see that you have. We want to be able to know that you'll be a good fit for our unit, right? So the other thing that I would say is definitely think about your strengths, your weaknesses. What are you good at? What are you not so good at? It's okay because we all have weaknesses. Nobody is perfect. They definitely do not expect you to be perfect, and they actually really appreciate when you are able to answer the questions of what some of your weaknesses are. So don't think it'll be a deal breaker. It can actually be really helpful because they want you to be honest and really know your limitations, right? I know for me, some of my weaknesses is I tend to overwork, and sometimes it could be a good thing because they want to know that you're a hard worker. But of course, it can be, a weakness because it can take away from having a good, life and work balance, right? So definitely know about some of the things that you're good at or you're not so good at. If you do not know, talk to your friends, talk to your past co-workers, and really get to know who you are and what you are good at, okay? So the other questions that I would say pretty much is a given is think about maybe some experiences that you've had. Maybe it's in clinicals or maybe it's in your past work experience. How do you deal with an emergency situation, right? You can talk about maybe a code situation that you had, or maybe you just had someone that was hypoglycemic. I don't know, you had to call rapid response. Definitely talk about some of the heroic things that you have done to help the situation. If you were in nursing school, they know that, there's only so much you could do without a preceptor or without your nursing instructor. But just tell them about, how you noticed the situation was declining and what did you do to help, okay? So another thing that I would say is definitely know about your chain of command. Who do you go to for help? When do you ask for help? Your managers definitely want to know that. Or if you have a conflict or confrontation with one of your coworkers or maybe with a physician, that you do know who to go to. Most likely they want to know that you are going to be talking to the person first, address the situation. And if that can't be resolved, then you can go to your clinical managers or your charge nurse. And if that's not working, then you can go to your nurse manager and then higher up. But they definitely want to know that you're going to follow the proper chain of commands before things are escalated, okay? So the other tip that I have for you guys is think about some of the past experiences that you might have, whether it's in your past job experiences, if you have experience with phlebotomy skills, or you worked as an LPN or PCA before. All of those things could be really good. If anything, if you put it in your resume, they're probably going to ask you about it anyways. But think about some of the experiences that you've had, and be prepared to talk about it, and be prepared to talk about some of the things that you have done that could be really helpful for the current position that you are applying for currently. Okay? So the other tip that I would have for you guys is think about why you are applying to the position that you are applying for, right? If you're applying to Med-Surg, why are you applying to Med-Surg? If it's the ED, why do you want to be an ED nurse? Just really take the time to really think about what your future plans are, and why do you want to be in that position that you are, okay? But I will tell you this, most places, they want to know that you will be in that position for at least a good year or and a half. I know we will definitely want to see employees grow, but we definitely want to know that, we can depend on you like 6 months or 7 months from now if you are applying for a position. So definitely take some time to really know exactly where you want to work, and really applying for the position that you are actually interested in and you want to learn and grow in, and you really want to at least be there for at least a year, okay? So that's definitely my tip for you. Know why you're applying for the position. Do a little bit of research about the actual unit that you're applying for. Maybe they have like a project that they're working on. Definitely be ready to talk about the unit and why you see yourself there, okay? The other tip that I would have for you is most nursing interviews always end with this question. What questions do you have for me, right? That is definitely a given. Always come prepared. Always have some questions. Do not come with, nothing prepared, where they ask you and you have nothing to say. It doesn't look good. It doesn't look like you really, did some research about the unit. So definitely have some questions for them. And if you don't know what to say, you can always talk about, the patient to nurse ratio, or you can even ask them, why do you guys love working in this position? But definitely have something to ask them, okay? Don't just come with nothing. All right. I love you guys. If you have any questions for me, just go ahead and put it in the comment section below. And of course, just like we close every video, don't forget that the world is waiting for what you have. It does not matter if there's millions, billions, however nurses that are out there doing what you are doing. Nobody can do it quite like you can. All right. I love you guys. Bye. Peace out.